Dr. Mike from Place Chiropractic, and I want to thank you in advance for the opportunity to talk this morning. I went to La Habra High School, and then I went to Cal State Fullerton for 4 years, and then I went to Los Angeles College of Chiropractic, and I graduated in April of 1988 with my doctorate of chiropractic. Opened up a practice in Orange, actually bought into a practice with 2 other chiropractors, and we were there for 9 years, and then they tore the building down because the building sold, and they revamped it all. And I moved about 100 yards east of where we were to where we are now, Place Chiropractic. And today we have 5 chiropractors in the office, all sharing space, keeps the overhead low. And we have an acupuncturist, 3 massage therapists, they all usually work at different times. And we have a pain management doctor, an orthopedic surgeon, and a physical medicine doctor that they come in once a month. And they use our office as a satellite office, but the great thing is that our patients can access them for convenience sake. Today I want to talk about technology in chiropractic, and specifically using instrumentation to adjust the spine. Using an instrument instead of a manual adjustment in many cases will take a lot of the anxiety away from a patient getting adjusted. A lot of people don't go to chiropractic because of that anxiety. And who do you know has been to a chiropractor? I'm sorry, who do you know has not been to a chiropractor because they fear neck popping?
My wife until she came here.
Oh, good.
That was, for a long time I wouldn't go, but I let him do it.
Well, there's a lot of people that are fear of the neck getting popped. So actually, the neck adjustment is very safe. Not too many people get hurt. Why chiropractors not practice. But I'm gonna demonstrate a neck adjustment right here. It's very simple.
Yeah.
Oh my God!
It's a good thing. Do it the other way.
That was a good one.
The first instrument that was invented for chiropractors was the activator. It was like a little spring-loaded handgun about the size of your fist. And the doctor would go down the spine and do the various areas. Then they developed the kind you plug in the wall. It's like a little, almost like a nail gun. It would hit. Then they developed ones that would actually hit several times. And then you could alter the intensity. And then about 14 years ago, Pro Adjuster was developed, and that's a lot of you have been in the office and you've seen what the Pro Adjuster is, but it has a little bit different technology. The idea behind the Pro Adjuster, it doesn't just adjust, but it also allows the doctor to analyze, then adjust the spine without any popping or cracking. And the way it works is that the patient would be sitting in like a massage chair position, and the doctor would go down each level of the spine, and it measures the resistance and the resiliency of the joint. And so he would go, the gun actually is fed into a computer, and it registers on a graph, you know, how the joint is moving or not moving. So we can determine which joints to adjust, so we can be really specific. And when we adjust the joints, we're putting the wand right over the area that's not moving. And it's a repetitive tapping with a really high frequency, and it'll keep tapping that joint until the joint releases. And it has a sensor in it, and that's what sets Pro Adjuster away from the other devices. It'll keep pounding that joint. It might go 10 times and stop, but it might go 1,000 times and then stop. And when it feels the joints let up, it just stops on its own. So it's computerized, and because it's computerized, it's consistent and it's very comfortable. So the Pro Adjuster takes the fear out of people getting adjusted, and usually I will adjust new patients manually because that's what they expect, and then I'll introduce the Pro Adjuster to them down the road, you know, sometime during the course of their care, and I let them choose which way they want to be adjusted. Because some people just like the manual, some people only like Pro Adjuster, and some people like to mix it up back and forth. A lot of people actually like to mix it up, but it really depends on what the patient likes. So this leads me into one of my top referrals. It's someone who's never been to a chiropractor because they fear their neck getting popped or cracked. So they don't have to, they can sit there and relax, get a solid adjustment, feel good when they leave without having to go through the anxiety of getting popped. Also, someone who's been involved in a recent sports injury. Most people think that chiropractors treat the spine only, but we treat wrists, elbows, ankles, knees. I've been treating the Santa Ana High School wrestling team for 20 years, and most of the injuries that we get from the team are just the simple sprains and strains. Actually get a lot of fractures too, but we just send those out. But the simple sprains and strains, they're important to treat, because if you don't treat a simple strain, you know, if you don't treat it, it eventually will lead to joint dysfunction, and then down the road can lead into an arthritic condition. In fact, most people, I should say not most people, but there's a high incidence of arthritis in people who are athletic, athletes when they're older. Mike knows. People have injuries when they're doing the sports, and they don't always treat them properly, and then, you know, when you're 60 years old, you're really feeling the result of those old injuries. Another good referral for me is someone who has been involved in a motor vehicle accident. I've treated the motor vehicle accidents for a long time. I know the ins and outs, and it's important to treat these cases without raising red flags, because usually there's a third party that's actually paying for the care for these patients, and they really only want to pay for reasonable and necessary care. So you have to really make sure that your documentation is clean and it makes sense. I mean, Tom knows, he probably tries to settle, we do a lot of business together, but if you don't make sure your T's are crossed and your I's are dotted and everything makes sense, then it makes it hard for the attorney to settle a claim, or if you don't have an attorney and you're trying to settle on your own. Adjusters are going to look at things and pull out, hey, well, there's a red flag, I'm not going to pay because of this one. They'll always find a reason not to pay. And insurance companies hire adjusters to pay as little as possible, but realistically, adjusters, they want to pay the claim, they want to resolve it, but they only want to pay what's reasonable and what's necessary to get that patient better. The most common red flags I see are people that they don't go to the doctor soon enough. They wait a week or 2 weeks. Or sometimes, like I just had one, waited almost 2 months before he came in. It really doesn't look that good, because the adjuster's going, well, if he was hurt, he would have been to the doctor a lot earlier. So I would say, you know, if you can go the same day of an accident, or at least by the next day, to get some kind of documentation that he has some kind of symptom. Another red flag I see is people, you know, they'll be treating, and then they'll start feeling better, and then they'll miss 2 weeks because they're feeling better, and then they'll start back up because they start hurting again. So these gaps in care do not look good, and it also will prolong. That causes the whole case treatment to prolong. And adjusters want to see people get treatment, be released, be well, and then just be done with it. So again, the documentation is important to keep things clean. And I've also worked on the opposite side of the fence with the insurance company. We do defense work. We'll get files sent to us from the insurance company where the insurance company thinks maybe there's over-treatment or there's fraud involved, or they just don't think the patient was injured. And we will write a report, give our opinion as to whether the care was reasonable, or sometimes we have to go into court testifying for the insurance company on behalf of them. And that experience that we have has given, helps us not make the mistakes a lot of other doctors make when in treating these injuries. So my last great referral, so avoiding the red flags is crucial. The last great referral I have is people who have been involved in industrial injuries. They're hurt at work. When you're involved in a work injury, you're required to treat with the employer's insurance company's provider network. Every employer has workers' comp insurance, hopefully, and the insurance company has a network of doctors that you're required to go to someone in that group. And between my partner, Dr. Doring, and myself, we're on most of the provider networks, so we can actually access those patients. 1 minute. And also, I'm a qualified medical evaluator, which means I was appointed by the state of California to provide unbiased examinations for injured workers. Essentially what a QME does, Qualified Medical Examiner, is that we try to settle disputes between insurance companies or patients, or an insurance company and an attorney. An example would be if a patient was getting